Hi, I'm Julie, editor-in-chief of the Well by Northwell. When I'm not chained to my desk, you might find me someplace like where we're going, on my next mission to find things that are totally off limits, behind the scenes, or TMI. And let's be honest, what's more TMI than a colonoscopy? That's why today we're going inside your insides to get the scoop on poop so you know exactly what to expect during a colonoscopy. Let's go inside. Dr. Pirro, hi. Good to see you.
Julie, nice to see you.
Thank you for having us here. We're really excited to get a tour of what it's like to get a colonoscopy. And I know that a lot of people are hesitant to do it because the prep seems so daunting. Can you walk us through that a little bit?
Yeah, so there's a lot of reasons people won't have a colonoscopy. So things people get concerned about include the preparation. All preps suck. There is no good preparation for a colonoscopy, whether you're drinking something or swallowing pills, they all suck. But everyone's able to get through it, and we're not expecting a fun time that night. We just want patients to be safe, as comfortable as possible, and clean out the colon as best as we can so that we can find the polyps that we're looking for.
Okay, so we're going to demystify this whole process for our audience. You ready?
Yep.
Okay.
All right, so we're going to have you kind of walk in the shoes in a day in the life of a colonoscopy here at our facility.
Okay.
So I'm going to leave you with my staff, and then you'll see me where a patient might normally meet me again during this process.
Okay,
Let's
see you
have some
later.
fun.
All right. If you're here for a colonoscopy, this would be your first stop. What would I need to do if I'm here?
So the office will either give you forms that you fill out beforehand, or there's a portal online, and then the day before, 2 days before, we'll go over all these questions. So this is a template of what the anesthesiologist is going to go over with you, and then on the second page, we'll go over your medications, if you're diabetic, if you have any allergies, and then once we go through all that, we'll call the nurses in the back, and then they'll let you know that you're ready for the procedure. Patient's ready.
Hi Julie, my name's Amanda. If you're a patient, you come with me.
Great, thank you.
Very different than your typical doctor's visit. However, we are going to review your health history as you would when you saw your doctor prior to the procedure.
Okay,
So
what are you looking for?
we're really looking for any red flags that we're going to have to make adjustments to so you can have the safe procedure in the back.
Okay, so I've been a very good patient. I followed all the rules. So what happens next?
Yeah, so now this would be the point where I'm going to bring you into the back where we do the procedures. I have everyone use the bathroom before they get changed. Then I'm going to bring you into the back, give you some instructions on how to get changed.
Okay.
All right, let's go. So this is going to be your spot before and after the procedure.
Okay, I like it.
All right.
It'll do. We have a gown.
Now,
Fashion show.
so common mistake that patients make.
Oh.
Right. You need to turn it around
I'm
to
the
the
dumb
back. See, that's okay. It happens a lot. You're just going to turn your gown around and put it to the back.
Oh.
So now that you're changed, we're going to have you lay down in the bed and get comfortable.
Okay.
All right. So you're going to go ahead and lay back.
Thank you.
Perfect. All right. Feeling comfortable?
Yes.
All right. I'm going to cover you with the sheet. Everyone comes in so nervous, and by the time you get back here, I really want your nerves to be down here and not up here. Okay.
And are people medicated at this point? Like, did they take anything?
You don't get medicated, right? So we're just talking you through, keeping you nice and calm. This is where the time will come where the doctors are ready for you for the procedure.
Hi, Julie. How are you?
Hi, good. How are
I'm
you?
Dr. Matthew Bedona from Anesthesia. Nice to meet you.
Nice to
I'm
meet
going to
you.
take care of you today. We're going to go through, or we would normally be going through with you or anyone else for this experience. We would ask you about your medical history, your surgical history, your family history of anesthesia, your personal history of anesthetic issues, your social history, any recent drug use, any recent alcohol use.
And
Obviously,
what if there is?
Well, if there is, it depends on when, and it depends on how frequent. We'll give you some oxygen. We would give anyone else some oxygen because it's going to sedate you enough that we need to supplement their breathing. But this one is a deep sedation. It allows us to distend the colon with a gas called carbon dioxide, and it increases the detection rate for adenomas. That's why we do it that way.
Art of anesthesia. I like it.
Art of anesthesia. So Julie, we've gone through a lot, I know, and Dr. Pirro is going to come by, and once Dr. Pirro finishes up, I will be here. We'll jettison into the room. We'll get rocking and rolling.
Okay, so I'm not an actual patient, so I'm going to take this stuff off and then we'll continue. So be right back.
Hey, Julie, how are you?
I'm good, thank you, Dr. Pirro.
You having
How
fun
are you?
today?
Yeah, this is really fun.
Awesome. Is this your best fake colonoscopy ever?
Ever. You take the cake.
Awesome. Oh, thank you.
Yeah.
So what we would do here is this is where we say hi to each other, and we also talk about a small risk of bleeding. If there's any polyps that I remove or biopsies that I want to take to look at some tissue more closely, there's a small chance of bleeding at the site. Let's go check out the procedure room and we can see where we make the magic happen.
Awesome. Let's do it. There's a whole gang here.
Yes, so these are the people who will be in the room during a colonoscopy procedure. So obviously the person performing the colonoscopy, the anesthesiologist is here. We're going to have an endoscopy nurse and an endoscopy technician. So the next step are to really get you hooked up to the monitors and the oxygen.
So you're wheeled in, you're on the stretcher.
You're wheeled in, you're laying on your back, and we keep you on your back until the last possible moment. And then what happens is there's some oxygen here that gets hooked up and goes into some what we call nasal cannula into your nose. You get hooked up to a monitor, so you get some EKG leads in addition to a blood pressure cuff. Then we ask you to turn on your left side to get into position. So you get into position that you're comfortable. We want people in position before they're sedated, so we're not moving their whole body for them once they're sedated and essentially dead weight.
Does make sense.
All right, so once everyone's once you're in position, this team is ready. We'll turn out the lights, and typically, actually, we listen to music.
Okay, and how long does each one take?
So it depends. An upper endoscopy is about 10 minutes. A colonoscopy tends to take about 15 to 20 minutes. If we're doing both procedures at the same time, it'll be around 30 minutes procedure time in the room.
Do you wash your hands in between?
I do. That's a great
Good.
question.
Can you show us some stuff?
Absolutely. I'm going to show you a scope and how it works and what we might use to help us during the procedure. And we get started. We start here. We talked about lubrication. It helped us advance the scope into the patient and then to do the procedure. So here we would basically take the lube here, and then we would bring this over to the patient. And the first thing that we would do is a rectal exam just to make sure there's no obstacles to inserting the scope. So I would start with just some gel on my finger to do a rectal exam, and then I would take the scope, and I would get the lubrication on the scope, and then this would be inserted into the patient.
Is that as far as it goes?
Nope, that's how I put it in first before we actually start the procedure. So this is a scope. I'm going to show you a couple of things, and I'm going to let you play with the scope yourself, because
Okay.
it's pretty much awesome.
What's the diameter of this?
Yeah, so this is a little bit over a centimeter, or around a half an inch.
Looks a lot bigger.
It does look a lot bigger. However, the way we think about this is everyone in the world has had bowel movements much larger than this. So this is not a big deal to go in, because most bowel movements we have are in diameter much bigger than that.
That is true.
How do I get to do this? Once the scope is in, the rest of it is just us really looking at a screen and trying to get around to complete the colonoscopy and making sure to see if there's any polyps. If polyps are hiding in the wall of the colon is collapsed, we're not going to see them. So we put air in, or carbon dioxide, as we're doing the procedure to enable to see as much as we can as the colon wall to look for polyps. This will enable us to suction some out. So the two buttons are suction, this one gives air and washes. If we also want to take pictures during the procedure, there's other buttons here that are available to take pictures. If there is something that we remove, we can then suction that, and we can put a special, what we call, trap here to capture the polyp that we're suctioning out after it's been removed. You want to try to hold it yourself?
I really do.
All right.
What are we doing?
Yeah, that's a great question. You're going to come under. Yeah, we're limboing here. Yep.
Okay.
There.
Okay.
And then this finger can control the two buttons. So this is the tip of the scope. You see my hand here. And now you can use your thumb to control the up-down button.
You have to have a lot of dexterity for this.
Yeah, up and down. Now move it up and down.
You did it with one?
Yeah,
Wow.
one hand. There you go. Oh, now you got it. You see, you're ready to do a colonoscopy.
I'm so scared.
After about 15-20 minutes, the procedure is completed, and then the patient's escorted to the recovery room.
Okay. So we're in recovery now, so what happens here?
So the patient's wheeled in by the anesthesiologist and the nurse in the room. So you remain attached to the monitor, and patients are still sedated at this point in time. We then run through a series of vital signs as the patients gradually wake up. So that process takes about 15 minutes or so. They wake up feeling well. Now, what will happen is, because we do put in the carbon dioxide during the procedure, we try to take as much of that out using the suction as we're coming out during the colonoscopy with the scope. However, there can be some additional gas that's left behind, but yes, there will be patients here that are passing gas.
So this is where the farting happens.
This is where the farting happens, yes. What we can do now is I can show you actually where you would be waiting for the doctor to come to go over the results of the procedure. So we'll walk over there now. That is for the patient. They get the nice chair. This is where either I or a family will sit. It's important as we're having our final discussion, because this is where your colonoscopy journey would end. The patient is awake and post anesthesia at this point, so the recollection of our conversation isn't always the best. So that's why it's important, if they agree, that we have their family member or their ride with them so we can review the results. And that's the colonoscopy. And since you were such a great fake patient, we're going to let you actually take home some of the honey graham crackers that real colonoscopy patients might get.
I don't know about you, but I never thought I'd know so much about colonoscopies. If you haven't had a colonoscopy yet, save this video for your 45th birthday, because that's when the American Cancer Society recommends that everyone start getting screened for colon cancer. And if there's anything that we learned from Dr. Puro today, it's that colon cancer screening is not scary when you know what to expect. And you get snacks after.